First of all, I'm a physician and I specialize in orthopedic surgery. I've done a fellowship in spine surgery, and I practice orthopedics as well as spine surgery. And my practice consists of treatment, plus I do agreed medical examinations and qualified medical examinations. After going to an engineering college, Rensselaer Polytechnic Institute, I graduated from Albany Medical College, after which I did an internship and residency in orthopedic surgery at the Medical College of Pennsylvania in Philadelphia. Then I did a one-year spine surgery fellowship at the Curlin Job Clinic in Los Angeles area. What I like about the QME process is just what the title means. It's qualified medical examination. You're supposed to be an arbitrator to see where the treatment is, so you're able to be a third party who looks at the injured worker and the case to be able to evaluate AOE, COE, whether the injury has arisen out of the course of employment or occurred during the course of employment. You're able to assess compensability, what the impairment is, what the need for future treatment is, because very often we lose sight of the fact that there's a patient behind this illness, and in the scope of following pathways of treatment, people sometimes forget that you're not really allowing treatment, you're just allowing authorizations or denial of authorizations. And then also, sometimes the injured worker is a little lost in this whole phenomenon of the workers' comp scenario, and you need to be able to offer guidance to the treatment for primary care, the insurance company, the attorneys for both sides on where the case is. And you either leave that to an entity that does not understand the injured worker and the system, or you take and become a part of the solution, and I chose to become a part of the solution to this. You know, at the end of the day, behind an examination room, there's one physician and one patient. And at the end of the day, we are healthcare providers and physicians, and you really have to look at the needs and the desires of a patient and be able to take that in the scope of their pre-existing illnesses and take that with the injury that has occurred and be able to wrap up a package that is fair to the patient as well as the employer and all the parties involved to really assess the compensability of the injury and the need for treatment. Now, why is it important, you ask, to be able to sit and listen to the patient? Because we have no objective way of finding what the patient is feeling other than his or her subjective complaints. But on the other hand, you have to be able to tie those subjective complaints with objective data and objective findings.